Yeah, this was my first time coming to the continent, and this was a different meeting for me because, as you know, like unlike most of the meetings, this meeting was not about presenting original data for drug approval, or presenting a new groundbreaking finding that nobody has ever heard about. This meeting was not about that, and this meeting was not about people trying to persuade healthcare physicians that you should be prescribing this drug from tomorrow in the clinic. This meeting was not about that. This meeting was more about how can we do the best for our patients, acknowledging the limited resources that we have. We know that we don't have a lot of resources. We know that we are bound in so many ways, but within those boundaries, how can we make the best use of what we have? And this is what I call the cancer ground shot approach. As you know, like it's not about trying to get new things. It's about trying to make the best of what we already have and making sure that what we already know to work and what is affordable does reach each and every cancer patient. Cancer patients are dying due to lack of access to surgery. Surgery cures cancer. Cancer patients are dying due to lack of access to radiotherapy. Radiotherapy cures cancer. So, people are talking about how can we make precision oncology a reality in Africa. People are talking about immunotherapies in Africa. I don't think those should be our priorities. I think our priorities should be, first, how can all of these patients get surgery in time and get radiotherapy after that. That will be saving more lives than everything else. So we should focus on our priorities. We should focus on cancer ground set before moving to cancer moon set. And in this meeting, I found that to be the case in most of the sessions. In most of the sessions, we are talking about how to make that a reality. But yeah, sometimes I also feel like we are trying to copy paste high income countries. In some of the sessions, I got that feeling that we are just trying to copy paste high income countries, or high income countries are trying to tell low and middle income countries this is what you should be doing without acknowledging the reality of what's happening on the ground. I don't support that approach. And there is no point in low and middle income countries just copy pasting what high income countries are doing, because what high income countries are doing are not necessarily cost-effective interventions, A, and B, they do not apply to the reality of low and middle income countries. So we need to keep that in mind, and this meeting was, it felt more close to home.